So, what is the most common health problem you see in today's life?
Maybe for the last 20 years, what we see is there are so many psychosocial issues related, social problems, social issues. Nowadays, you see, because of children coming with addiction to mobile. Earlier, we used to see only alcoholics.
There was a myth that it exists till now also, because there are some mosques or dargahs.
Even today, many people forget about villagers. Even many educated people think that it is because of evil spirits or black magic.
Sir, in your daily practice in those days, were there experiments going on in clinic from your side on the patient? I'm telling you.
Unless trials are done, safety profile is being studied. They don't come to the market. Quality control.
In those days also.
Yeah, everything has been done. They don't accept that they have some kind of psychological illness. I must have slept nights or spent nights on bus stands of Kumta because there was no competition. I must have slept on bus stands of Kumta spreading a newspaper on the floor. See, that's why I keep telling in family counseling, when you go home, keep all the gadgets off. Don't use it. Spend time with your family. So, stress is experienced by all of us. Consistent and persistent stress leads to psychological problems.
Hello everyone, I am Tushar N and welcome to the Mouth of India. Today we are accompanied by a renowned psychiatrist, Mr. Anand Pandurangi. So let's welcome.
Namaskar.
Namaste. Sir, what takes you to dive into this profession? This was my first eagerly noted question actually.
See, I finished my MBBS in 1979. Internship I finished. Then I started a small clinic. Those days, postgraduate admissions were very simple. Just go to college, meet the dean, give application, and take the admission. They were the days. But I could have joined some other branches also. But somehow I thought I must start as a family physician. I started my general practice. It was on June 13th, 1979. I just did puja and came back. Immediately I got a lady who came with her son, who was about 6 or 7 years old. She came crying and said, my son has put a small
Some particles.
something in the nose and he's not able to breathe comfortably. So immediately I went. I used the scoop and brought it out. And she was very happy. But she came, it was an emergency for her. So she came running and she had not brought much, she brought only 2 rupees, I think. She said, I have not brought anything except these 2 1 rupee notes. 1 rupee 2 notes she had brought. I still have those notes with me, even today. I have preserved it. That is the first earning of my professional career. 2 rupees. 1 rupee 2 notes. I still have those 2 notes.
That's great, sir.
Yes.
Sir, in those days, I heard that getting money was not the only intention.
Apart from that, I could have joined a post-graduation immediately, but somehow I thought I must start a general practice, like a family physician, visit houses, check blood pressure, treat them at home. This was the concept then, it was in 1978-79. So I started that and somehow, I don't know, destiny is something different. I lost my father in between and I was a little disturbed. I didn't know what to do. Then there was a course started in the present demands, the then mental institute. They started one postgraduate course in psychiatry.
Okay.
So I just joined there. I just thought I can go in the morning there and evening I can have my routine practice. So earn and learn. I can do both. So that was the concept and I started. Somehow I did my DPM in 1982. Then my examiner was my guru, with whom I worked in mirrors. So he said, "Will you join me?" I said, "If I get through, certainly I'll come and join you, sir." That's how it started. And then in between, I got married in the month of June 1982. Then I went to mirrors. I went to mirrors. A close family friend of mine took me to Dr. Sigdar's hospital, Kripamai Institute for Mental Health, Vanleswadi Mirrors. And I went with my wife. So I told him that I am very keen to join you here. And my wife also has come. She has done her MA in psychology. Then he said, "It's wonderful, both of you can join me." That's how we started our career in 1982 as residents in Mirrors. And I was there for 2.5 to 3 years. It was different exposure for me, different exposure. And whatever I am today now, I owe a lot to my teacher who taught me the basic communication skills, keeping a proper rapport with the community, a social responsibilities. Everything was taught to me there because it's a different institute.
Exactly.
It was one of the, because that was the only center which used to drain cases from North Karnataka also those days. Yes. That's how I came in touch with so many people of Hubli, Dharwar, Gadag, and other places, so, and especially Belgaum, bordering talukas and all that. They used to come to Mirrors. That's how I was there for 3 years. Eventually, I just thought I should start my practice in Dharwar and came back. Those days, things were different. This was an unheard branch. Psychiatry was totally an unheard branch. People never used to accept you, and they never used to accept that they have some kind of mental illness with them. It was a big taboo.
Correct.
It was a big taboo. So I started in 85 beginning. Then eventually first 2-3 months it was quite difficult. First case seen by me was in Dr. S.R. Ramangowda's hospital.
Acha.
I still remember the consultation was 15 rupees. That's what he gave me. I should not forget him because he's the one who showed me the first case. So that's how our journey started. First 3-4 months, I hardly had any cases. Eventually, I thought I should not sit in one place. I should move around, educate people because they don't accept that they have some kind of psychological illness. Maybe anxiety, maybe depression. They are all very common, but they don't accept that it is a psychological problem. So I just thought I should have some extension centers. So I started visiting Gadag every week, every Sunday, and visiting Haveri, Ashwini Hospital, Haveri, alternate Saturdays. And first Saturday I used to go to Kumta,
The
North
coastal belt.
Canada. Yes. I used to visit Kumta Nursing Home then. I did all those things for almost 12 to 15 years, continuously, uninterrupted. Not even one visit I missed in 15 years. Not even one visit I missed. So I used to talk to people, educate them. Um, it is not because of the evil spirits. The basic concept in the public is
The evil spirit.
Going to traditional healers, thinking about black magic and all that.
I was coming to that point only, sir. Because what was there then in 70s that there was a myth that it exists till now also, because there are some mosques or dargahs and these
Even
things.
today, many people forget about villagers. Even many educated people think that it is because of evil spirits or black magic, something like that. But basically, you need to educate them scientifically. That's what is required. And we did a bit of exercise along with our Indian Psychiatric Society. We used to have community programs, school mental health programs, teachers training programs. That's how we used to talk to the community on myths and misconceptions about mental illness.
The communal health heads.
Yes, educate them. It is not because of evil spirits of or possession of God or something like that. What we call as a possession syndrome or dissociative disorder, something like that. It's not because of that. There is a scientific base for that. We used to explain them, and apart from that, we used to go to schools, talk to children about positive mental health, and teachers orientation programs wherein we used to talk to them about the common psychological problems in children, identifying them, and remedial measures for that. And many times we used to attend these parent teacher meetings wherein we used to talk to parents, their role as a parent in guiding students, identifying the common problems with them. This is how the journey started, with more of community focus and community education. There is a basic need of that time. So now I think because of media, there are so many things you see on the media, exposure, everything.
Yes, yes.
See, people are quite aware. Any slightest change in the behavior, they approach the consultants now. They approach the counselors because there is a enormous scientific material given to them through media, maybe through print media or electronic media and social media and all that. So this is how people are sensitized now, that mental illnesses are also like any other illness, to be treated, and if treated, the quality of life is better. This is what is the message given to the society now. It is being done by all the colleagues. Not only I do it, all our colleagues do it across the state, across the country.
But then too, sir, they have a stage set now because the senior psychiatrist like you
No,
strived a lot.
the present generation is quite lucky,
Yes, yes.
quite lucky. But what exercise we did, they need not have to do that.
Correct.
See, I went to Kumta. I must have slept nights or spent nights on bus stands of Kumta because there was no commutation. No proper buses were there. I must have gone many times in trucks,
Oh,
many times in matadors, and we never had direct Dharwad to Kumta buses. Direct buses were only one or two. I used to have cut from here to Hubli, Hubli to Sirsi, Sirsi to Kumta. This is how I must have traveled many times. And many times I must have missed my buses, and I must have slept on bus stands of Kumta spreading a newspaper on the floor. They were the days. Kumta, Honavar, Karwar, many places I have visited. See, now things are different. But those days, commutation was not there. Education, public awareness programs were not there. Now everywhere there is a mental health awareness program.
yes, yes. We see in outside a clinic also there are many such charts and everything.
Now
Make people aware.
Government also has made integrated health system. Mental health is one of the component of the integrated health system. So you have district mental health programs run by government. A lot of education is being done. So everybody has joined hands now. Social organizations, media, institutions. So that's how there is a lot of awareness now. Today the stage is such. If a child doesn't go to school for 2-3 days, or if a child doesn't listen to the parents' words, or if a child is a rebel, or any slightest change in the behavior of a child, they immediately approach the consultants. They approach counselors. They approach psychologists.
Mhm.
So now things are different. So there is a huge awareness now. That's how we keep getting a lot of, it's more of a guidance that we do. Things are different now than in the past. And now pharmacological advancement, scientific technologies, everything. New molecules are available for treatment of depression,
Yes.
schizophrenia, bipolar disorders, obsessive compulsive disorders. You name anything, there is a new,
There are a number of molecules available.
now a lot of newer molecules are available which are very safe. Side effect profiles are much less. So selective molecules are available now. Earlier we used to use only imipramine and amitriptyline. For psychosis, we used to use trifluperazine, haloperidol, and chlorpromazine. Now things are different. You have olanzapine, you have risperidone, you have clozapine, you have quetiapine. You have many molecules available now. Lurasidone, risperidone.
But then to sir, these molecules have been compulsorily this thing done that it should
No,
be
no,
getted
they are
with
all time tested now.
time tested.
Time tested, FDA approved,
Mm-hmm.
and good lot of trials have been done. Unless safety profile is there, they don't permit them to the market, is it not? So that's how most of the molecules are very safe now. The quality of life is totally different. You cannot even make out that they are on treatment.
That's right.
You can't even make out they are on treatment now.
Sir, in your daily practice in those days, were there experiments going on in clinic from your side?
No, newer molecules experiments were going on. Mm, Definitely,
On the patient, I'm telling you. For example, if you give a simple in just a specifying words like paracetamol, is that drug working him on the right path or no? So would you diagnose it?
unless trials are done,
Mm-hmm.
safety profile is being studied,
Mm-hmm.
they don't come to the market. Quality control,
In those days also.
yeah, everything has been done. Otherwise, they don't come to the market only. Safety profile is excellent. All these molecules, only thing is how much to use, when to use, when not to use must be
Yeah, trial and
thought
tested.
thought by the attending doctors. But they are all very extremely good molecules are available. Very nice. The quality of life is better. They can, you can't even make out that they are on treatment. Even if you think of depression, newer molecules, selective serotonin reuptake inhibitors, SNRIs, there are so many things available. They selectively block the receptors. Side effect profile is minimized. So there are many things, many things. There's a good revolution in psychopharmacology.
Correct.
And we are no less than rest of the world. Whatever is available outside the world is available in India today. Is it not?
Correct, correct.
You do know that during COVID time, we were the first one to introduce COVID vaccine, is it not?
Yes, yes.
So it's a credibility. We are no less than anyone in the world. We are on par with any of the countries around us.
The good amount of population.
Yes, yes, yes. Extremely good. The medical services, the available facilities in India are extremely good. Extremely good. No way. Even in psychiatry, you have wonderful institutes. You have ACE institutes, is it not?
Yes, yes.
So good things are being done.
One thing, sir, getting a wife as a psychological counselor with you, that helped you for your career, or
No, definitely it has made a good support to me
because they
in
know
my
your
profession.
sorrows and everything in your
No, because half the job is done by them. Because most of the anxiety patients, depressive patients, OCD patients, any cases that you see, unless they are psychotics, frank psychotics that you see, they all need counseling and guidance. So half the job is done by a psychologist. Our job is only to write prescription and send them. The rest of the job is done by psychologists and psychiatric social workers. Is it not? So their role is very important. It is a teamwork. It is not that I do. It is a teamwork. You need psychologists, you need psychiatric social workers. It is a teamwork. That's how things are different now.
so what is the most common health problem you see in today's life, sir, compared
No,
to
nowadays,
previous
when I started my career, type of cases I used to see were different. They were frank psychotics or bipolar patients or really disturbed, brought in acute excitement, something like that. But nowadays, maybe for the last 20 years, what we see is there are so many psychosocial issues related, social problems, social issues and community-based some kind of disturbances. Nowadays, you see, because of children coming with addiction to mobile. Earlier, we used to see only alcoholics,
Yes, yes.
substance abuse, polysubstance abuse. But now the most difficult thing is digital addiction, what we say. Post-COVID,
Mm-hmm.
we wanted the education to continue. So we adapted to online teaching and coaching. But the end result was most of them became totally dependent on gadgets.
Social medias.
See, it's so unfortunate. Most of the student community, they are addicted to gadgets. It becomes a compulsion. They know that they are not supposed to use it, but they are compelled to use it. It's an intrusive thought they get. Even I always keep telling them, even during sleep, your hands will be moving like this.
So, did you get any child, sir, in your daily practice?
Pardon?
Did you get any child or a parent coming with your child
No, no, no. A huge number of parents come.
for mobile addiction?
No, no. They bring their children. Most of the student community, the present problem is related to mobile and its gadgets. Social media, Facebook, Instagram. I don't know how to use it, but small kids, they use it.
One survey was done, sir. That was also narrated by Mr. Javed Akhtar. He said that if you tell a child to draw a picture, any picture, they will draw a mountain and a sun and a river passing through the mountain and the trees and a small hut. This is the psychology a child carry on today's date also, which were there then in 90s, 80s also. So there is, he said that there is no development in the child brain system. He said.
Basically, if we don't use much, we can tell our kids, is it not? See, that's why I keep telling in family counseling, when you go home, keep all the gadgets off. Don't use it. Spend time with your family. Spend quality time with the family. Spend quality time with the kids. So that it's a family bonding, is it not?
Yes.
Now we have everything, but if you don't have family bonding or family happiness, there's no point, is it not? What all you have around you is non-existent, is it not?
Exactly.
Unless you are happy with what you are doing.
Mm-hmm.
When you go home, you should be happy, is it not?
Yes.
So that's how it's a lot of education has been done at the community level about the psychological problems and addressing them, and the role of professionals in keeping the society at peace is being done.
So this means that the percentage of illness in mental illness is increasing now, as of today.
See, earlier also mental illnesses were there,
Mm.
but the awareness was much less.
Yes.
But now, because people are aware,
Mm-hmm.
they seek help.
They are diagnosed now.
They seek help. Maybe earlier days, if somebody is not able, he doesn't talk, they just, or even you take for example, special children, those who are intellectually little slow, they used to say he is little dull and leave him for himself. But now we assess their intelligence quotient. We assess, apart from that, we guide them, and we want such children to be the mainstream of the society. You have many remedial teaching methodologies, activity-based teaching. That's how you can train even underachievers also and slow learners also, intellectually disabled also, to get integrated with the mainstream of the society. This concept was not there earlier, is it not?
Yes, yes, yes.
They just used to leave him. He is dull and leave him. But now it is not so. The family structure is only 1 or 2 kids. Earlier we had 10 people at home. Joint family concept was there. They used to counsel themselves. But now the concept is only 1, maximum 2 kids. And if the child is slow and dull, immediately they approach the doctors. They seek help. They get their IQ assessed, personality assessed. They go in for remedial teaching, activity-based teaching. There is something in the child, is it not?
Yes, yes.
So try to find out what is there in the child and see that he is put to mainstream of the society. Is it not? So now things are different because of social structures, family structure, things are totally different now.
So now we can say that there are certain scales and a parameter set for the diagnosis of such
Yeah,
patients.
parameters
And
set,
for
and
their
apart from
improvement,
that, people seek help.
Acha.
That is the most important thing because they want the child to be normal and integrate to the mainstream of the society. That's a basic concept. The basic concept of treating in psychiatry is to see that he is with the mainstream of society.
Correct, correct.
He is with the rest of the kids. So social fabric, family fabric, and everything matters. Now the joint family concept is gone. You have only nuclear family. Both husband and wife are working.
Yes.
When both the parents are working, the child is left alone at home. He has nothing to do except playing on the mobile or on the TV. So there are so many things we need to understand, guide the family, guide the society.
So
It's
what
a
is
social
that
responsibility.
guidance you want to give to a nuclear family, wherein in the case that both parents are working
No,
and
it's a
the child is left at
work-life
home?
balance. That's what we use
Work-life
generally.
balance.
Work-life balance. Work you have to do because you will have to earn for your livelihood. Life is your personal life. You have to balance it. If you think of health, wealth, happiness,
Yes.
think of health, wealth, and happiness. I always tell you it's like a seesaw game. You see on small gardens a child playing on the seesaw game. Health and wealth, you can see up and down, is it not? But the basic fulcrum is happiness. With all ups and downs in health and wealth, the basic happiness should not go. That is what we need to conserve, is it not?
Yes, yes.
That's a basic thing.
So, in the context, sir, what takes depression? What is depression? This is what we want to know.
Depression is the most common,
How does it start?
Acha. Complex,
Mm-hmm.
most common complex. Many times it goes unnoticed, undiagnosed also. Most common, most complex, but many times it is not diagnosed and treated also. And it is a complex. It is multifactorial. Why I said complex? It is not because of one reason. It is multifactorial. It could be an endogenous depression. It could be because of stressors. It could be because of some acute emotional disturbance at the family level. There are so many factors which trigger depression. The most common complex, chronic, crippling disease. Many times what we say is most common, complex, crippling, and disabling. Sometimes when you are in depression, you feel crippled. You feel you can't function at all, is it not? You give him support, he jumps. It's very common. Complex because it is multifactorial. Crippling because you don't function. When you are in depression, you can't function properly. Crippling, disabling disorder. Depression leads to disability because you can't function. Is it not?
Yes, yes.
So it is to be treated. If you treat, I can assure you that if a depression is diagnosed and treated at early stage, the quality of life is excellent. You know, because earlier concept was some stressors, some environmental factors, or some family issues, or some loss at the family level, losing someone at the family, they all trigger. But now the concept is biopsychosocial.
Mm-hmm. What is it?
Because of biological neurotransmitters, serotonin, norepinephrine, dopamine, they are all responsible for fluctuations in your mood. Why you become dull during winter? Generally in European countries they say winter blues or seasonal blues. Cold climate triggers depression, is it not? So that's how when it's very cold, you feel sluggish and you don't feel like going out. The moment you see the sun rays, you go out, is it not?
Yes, yes.
So it's all related to neurotransmitters, biological, psychological factors. That depends on one's own psychological this one, and social stresses around you. So it's a scientific explanation now. You agree with me now? There are many people with disability. Some are blind,
Yes.
some have no hand, some have no fingers. With all that they live and they excel in life. When somebody can dance with a Jaipur foot and become a dancer of national repute, you know, is it not? Don't you think she's a role model for most of them who think of suicide?
100%.
They have everything, they want to end the life. Somebody with no leg also wearing Jaipur foot, the focus is to
Achieve that goal.
achieve something in life. Blind, wonderful achievers. So what I am trying to tell, of all the components of health, physical health, psychological health, social health, and spiritual health. Physical health, okay, fine. Psychological, if you are disturbed, rest of the health components, they don't work. Despite all the physical disabilities,
Mm-hmm.
people excel. It's only because of the strong determination and willpower. A person having everything also, he gets depression and he wants to end his life. How do you correlate that? So that's why I keep telling, depression is an illness to be treated and to be guided and to be followed up.
Follow up is very important.
Follow up is very important. Otherwise, recurrence and relapse is very common. Depression, recurrence, and relapse is very common. Any psychological illnesses you take, recurrence and relapses are very common. So you need to guide your patients properly.
Sir, we had heard a contest that stress and anxiety, these differences, a famous Bollywood this thing.
No. Stress,
Uh,
you have stress,
yes.
I have stress. Stress is experienced by all of us.
Acha.
Stress is an integral part of our life.
Mm-hmm.
Managing stress has to be learned by us.
Yes.
It is a constant, persistent stress leads to psychological problems like anxiety, depression, and other illnesses. Stress, every one of us experience stress. We know how to manage our stress. That's how we are fine. We use our coping skills. See, the moment examination is announced, you become alert. Stage of alarm. Then you get adjusted, stage of resistance. Then some of them say, I can't do it, I just want to leave it. Stage of exhaustion. So it is at this stage of exhaustion, you start experiencing some psychological problems. So anxiety, maybe some of them generalize anxiety disorders with OCD, obsessive compulsive disorders, you see. See, there are so many things you start experiencing, or you may go in for a depression. Is it not?
Yes.
So stress is experienced by all of us. It is a chronic stress, consistent and persistent stress leads to psychological problems.
Great, sir. It is very finely explained.